Hello, we would like to continue our study in pharmacology, and today we will look at some basics or some basic concepts of pharmacology. We want to introduce ourselves to the subject of pharmacology. So let's dive in. Now, what is pharmacology? What is pharmacology? The word is a Greek word, Pharmakon and logia. Pharmakon meaning medicine or drugs, and logia meaning study of. So basically, when we say pharmacology, we are talking about the study of medicines or the study of drugs. Now, because it concerns drugs, then it means we want to look at the nature of the drug. We want to look at the properties of the drug. We want to look at the uses of the drug. We want to look at the way, the mechanism or mode of action of the drug. And then we also want to see how the drug is able to elicit an effect. So we will look at the effects of the drug. Now, concerning effects, there are two main types of effects that we may see. If the effect is going to minimize the disease, is beneficial, we call it therapeutic effect. And if the effect is something that is undesired, something that is undesirable, we will call it a toxic effect, a toxic effect. So it can be something that the medicine, just by its molecule or by its nature, gives. In that case, we will describe it as a side effect, an unintended effect, but it's something that by reason of the molecule that is being used, it's predictable symptom that will show. But there are also sometimes certain toxic effects that are not predictable. Undesired, yes, but this time unexpected, and sometimes it just occurs, and it does not occur in everybody. That will be called an adverse effect. An adverse effect. So that adverse effects and side effects both are examples of toxic effects of the drug, and the ability for the drug to eradicate headaches or for the drug to help bring down the blood pressure will be what will be called the therapeutic effect. Pharmacology involves two main things or arms, branches. These are pharmacodynamics and pharmacokinetics. And again, you can see pharmakon, which is drug. Dynamics is the ability to cause changes. So pharmacodynamics basically refers to the ability of the drug to cause the effect that we are looking at. So how is the drug able to cause an effect? Or what is the effect that the drug causes in the body? This is pharmacodynamics. In other words, pharmacodynamics is what the drug does to the body. The drug's potency, the drug's strength, the drug's efficacy, the drug's ability is what we mean by pharmacodynamics. Now, pharmacokinetics, on the other hand, has to do with kinetics, movement. So pharmacokinetics deals with how the drug moves through the body. So it moves from one point to another point. How does it do that? That is pharmacodynamics. And there are four main processes or four main arms under pharmacodynamics. This is commonly usually referred to as ADME: absorption, distribution, metabolism, and excretion. So pharmacodynamics has to do with the effect of the drug, and pharmacokinetics has to do with the movement of the drug. In other words, what the body is doing to the drug. So if you look at these two arms, what the body is doing to the drug, pharmacokinetics, and what the drug is doing to the body, pharmacodynamics, these two become the two main branches of pharmacology. So if we want to study pharmacology, then it means we have to look at these two arms of pharmacology. and that is what our study is going to be about. We will look first at pharmacokinetics. So what is pharmacokinetics? We have said is the movement of the drug. So how do we look at it? So let's look at this case scenario. We have Dr. Smith, who has a patient by the name John, a 60-year-old man with hypertension. Now, John comes to Dr. Smith. Dr. Smith writes a prescription that is supposed to help John's pressure or hypertension reduce. Now, John is curious and he wants to find out. So, doc, when I take this medication, how would the medicine be able to do what it's supposed to do? So here, Dr. Smith is going to take John through the pharmacokinetic properties or through the pharmacokinetic principles. So ADME, he was going to show John how the drug, when it takes orally, is going to enter into the bloodstream. That has to do with absorption. Now, once inside the bloodstream, how is this drug going to spread through John's body? That is distribution. And once it is spread through the body, is there a way this drug is going to be modified, going to be changed by chemical reactions or by chemical activities? And that is metabolism, what the liver and other minor organs are going to do in changing the nature of the drug. And finally, after the drug has been changed, and we will notice as we go on that the purpose of metabolism is basically to make the drug soluble, water soluble, so that it can be eliminated. So the changing of the drug by the body is so that the body can eliminate it. And then finally, we will look at how the body eliminates the drug. So these four ADME processes or principles are what encompasses or what makes up pharmacokinetics. Pharmacokinetics. And that is what we want to look at. And we may look at some factors that may affect all these principles of ADME. So here is John, and Dr. Smith is trying to help him to appreciate it. So we have the medication, as you can see. John is taking a capsule. He's swallowing the capsule, which goes into his stomach, and then will go into his intestines. Now, how is the drug going to move from this oral form and get into the bloodstream? That takes absorption. So absorption is how we will get the drug into the bloodstream. Then, once it gets into the bloodstream, how is the drug going to be able to move from where it entered into the bloodstream to the whole part of the body? This is what we call, the principle here is distribution. Distribution, how is the drug going to be distributed all over the body? And then once it is being distributed, it eventually means it goes to every part of the body and it will go through the liver. The liver is the biochemical transformation organ, the organ that is responsible for the transformation of the drug to make it soluble enough to be eliminated. So how is the drug going to be broken down? That is the metabolic processes. And finally, how is the drug going to be removed from the body? That has to do with the elimination or excretion. So let's start with absorption. Absorption. This is the first principle of pharmacokinetics. And absorption basically refers to the movement of the drug from where it is administered, what is called the site of administration, until it gets to the bloodstream. The moment the drug gets into the bloodstream, absorption has ceased. Absorption, the principle of absorption is ended. So it's the movement from the site of administration to the bloodstream. Once inside the bloodstream, absorption has finished its work. And usually because it is in a human body or it's in a body, then it's going to have some barriers, biological barriers to cross. For example, we talked about Chris, who took it orally. It has to cross the stomach walls before it can get into the bloodstream. That stomach wall becomes our biological barrier. So absorption usually is across a biological barrier. Now, it's important we look at site of administration and we look at some biological barriers and how we cross that. But we should also note that when we talk about site of administration, each site will have a different type of form in which the drug must be put. So, for example, if the drug is supposed to be used into the anus rectally, the drug must be in the suppository form. If you are going to give the drug to a child, it must be a liquid form. If you're going to orally, I mean, and if it's going to be an adult, a tablet or capsule or liquid form, whichever way, it's okay. So the site of administration, the way you want to get the drug into the body determines what form you want to put the drug in. If you're going to apply it on the skin, it must be a cream or a gel or something like that. So that if we want to look at the route or the site of administration, definitely we will also have to look at the dosage forms in which the drug can be. So absorption will lead us to looking at sites or routes of administration, and absorption will lead us to look at some forms of the drug, dosage forms of the drug. So now let's look at the routes. What are some routes of administration for our drugs? The drugs that are available, what are some of our routes of administration? Primarily, we will group these routes of administration into three main forms. The enteral dosage form. So the route, the enteral route, which has to do with the gastrointestinal tract. If the drug is going to go orally, or the drug is going to have some form of contact with the GIT, the gastrointestinal tract, we will refer or address this type of administrative route as enteral route. So oral drugs that are taken orally are described as enteral, or drugs that are taken sublingually are also described as enteral. Drugs that are taken buccally are also described as enteral. And since the rectal, the anus, has to do with the GIT, drugs that are also put into the rectal or the anus, rectum, is also described as enteral. Now, if you use the drug and the drug is not going to be in contact with the enteral route, then we will describe it as the parenteral. Parenteral meaning around the enteral. So if you are given a drug and it's going to go around the enteral route, this is usually referred to as the parenteral. Mostly these are the injectables that we have. So we can inject into the vein, intravenous, into the arteries, intra-artery, into muscles, into the skin, even into specialized places like the spinal cord or the spinal region. So we can have intraspinal, which could include epidural or intrathecal. These are all described as parenteral, around the enteral. And then any other route that's available, we will just describe it as the others. In other words, these ones are not directly connecting to the GI tract, and they are not going around it all the way. So any other route by which we can administer our drug, apart from the enteral or the parenteral, will be described as the others. So if we put it into the nose, intranasal, or we inhale it into the lungs, inhalational, or we put it into the vagina, or we put it into the eyes or the ears or on the skin, these are all put under others. These three routes of administration will then determine or will then give us the form in which we must put our drug. So then we will look at the dosage forms that are available, and there are various dosage forms. These are so, or they are necessitated because of the various routes, so that the routes will tell you which form your drug is supposed to be in. And here are some of the forms that are available. The drug can be a pill, which will mean a capsule or a tablet. The drug can be a lozenges, which is the one that we lick like toffee. So your Streptol, your Mentos, lozenges, these are the ones that you will lick like toffee. The drug can be in a paste form, pistil, or it can be a powder, it can be a solution or suspension, it can be a suppository, it can be a pastry, and you note that the names or the names usually help us see the form in which they are. So if it's something that is going to be gargled, it means it's something you're going to put into the throat, but you are going to bring it out. So that is basically it. All right. So in picture form, you can see these dosage forms. You take time and familiarize yourself with these dosage forms. All right. So now let's get back to our pharmacokinetic principles. So the first principle we are saying is absorption, movement of the drug from where we administer it, and we have seen it could be enteral, it could be parenteral, or it could be others. So wherever we administer it, whatever site, and then we're moving on to until we get to the bloodstream. Until we get to the bloodstream, that will be absorption. That will be absorption. All right. So most drugs will have to be absorbed before it can take action, before it can have an effect. Now, I say most drugs because there are some forms, dosage forms, which means we put the drug directly into the bloodstream, and therefore, technically, those forms will be described as not involving absorption. For example, if you put it intravenously, or if you put it intraarterially, we can say intravascularly into either the veins or the arteries, because it's going straight into the bloodstream, that is considered as not involving drug absorption. So in that case, those two parenteral administration do not involve absorption. Every other form involves absorption, and therefore we are saying that generally most drugs, and even those that are available parenterally, sometimes are also available in the other dosage form. Therefore, we will say that a drug must be absorbed before it can give you an effect. The absorption rate, the absorption quantity, all depends on the route. If you give a drug inhalationally, intrabuccally, or nasally, or ocularly, intraocularly, all of these will affect the amount of drug that will get into the bloodstream. Therefore, we are saying absorption depends also on the route of administration. Because intravascular is not considered a direct way, or I mean directly involving absorption, we can say that the fastest route of drug absorption is inhalation. And I will use a short picture to show you that the fastest route of drug absorption is inhalation. All right. Now, because we're going to cross a biological barrier in absorption, absorption usually leads to some loss of the drug. This also notwithstanding not only biological barriers, but sometimes we have metabolism occurring even before the drug gets to the bloodstream. Now, this is called the first pass effect or the first pass metabolism. So, and this usually occurs with especially the enteral route, the oral route. If you give a drug orally, before it gets into the bloodstream, it has to pass through the hepatic portal system. And in doing that, you're going to have some of the drug loss. So, a drug that goes through absorption will usually lead to the loss of some of the drug. And this has to be factored in by manufacturers when they are doing the drug in that dosage form. So in drug development, you always consider absorption before you go ahead and design the form in which you want to put your drug. All right. If it is given intravascularly, because there's no absorption, technically, we will say there is no loss of the drug. In other words, you will give 100% of the drug into the system. All right. Now, how much of the drug that's able to get into the bloodstream is described as the bioavailability. In other words, the proportion of the drug that enters the bloodstream once you give the drug, we will describe that as the bioavailability of the drug. So you give the drug, let's say orally, and you have given 50 milligrams, and when it gets into the blood, the proportion of the drug that got into the bloodstream was 25 milligrams, which means we have lost 25 milligrams due to absorption. That 25 milligrams will be described as the bioavailability of the drug. In this case, either given in proportion, 0.5%, or in percentage, 50%. So you can say the drug has a 50% bioavailability or a 0.5 bioavailability if you are doing proportion or you are doing percentages. Normally, it is described in percentages because percentages are easier to understand and appreciate. Now, because we said intravascularly there is no loss in the drug, we will say that intravascularly there is 100% bioavailability. So by definition, if you give a drug intravenously or intraarterially, that drug is said to have 100% bioavailability when it is administered. Now, this is the image I said I will use to help us appreciate how inhalation is the fastest route of drug absorption. So now we have 1, 2, and 3 here as showing various types of routes. So now this is the enteral route, so the GI tract. This is the venous route, you put it into the vein. And this is the inhalational route. And this is the process by which the drug is going to get into the artery. And the artery is when the drug is moving from the heart to the rest of the body. In other words, the artery is the vessel, blood vessel through which blood moves to the rest of the body. And the veins, blood move from the rest of the body to the heart. So now, let's say a person takes an oral drug. This is one. First, the drug must move from the GI tract and get into the hepatic system. This is the hepatic portal system. And because it goes into this system before it even gets into the bloodstream, some of the drug is lost. This is what we call the first pass effect or the first pass metabolism. Now, from the hepatic system, it moves into the veins, which means its direction is toward the heart, because the vein is the blood vessel that carries blood to the heart. Then it goes into the heart. From the heart, it must go to the lungs for oxygenation. So from the heart, it moves to the lungs. The right ventricles will pump it to the lungs for oxygenation. Then, and in other words, oxygenation of the blood. Then it comes back to the heart, and the left ventricle will now push it to the arteries. So if you look at this stepwise process, you notice that if you take it orally, it must go through all these stages before it gets to the artery. If you take it through the veins, it must still go to the heart, the lungs, back to the heart before it gets to the artery and the rest of the body. But if you give it inhalationally, you are able to skip this first part, which is the liver, the vein, and then the heart. You are able to skip that, and then you will have your drug going from the lungs to the heart and to the arteries. So if you look at the graph here, you notice that the slowest of them is one, oral. And notice how long it takes before you can get your drug in your bloodstream. And the second slowest is your intravenous. It also takes time compared to the inhalation. The inhalation, therefore, is the fastest route to get your bioavailable drug, to get your drug available in the bloodstream. Inhalation is the fastest route of drug absorption. All right. So this is where we will end our first lesson, or our lesson on pharmacokinetics. We will continue the next lesson as we take the processes by which absorption occurs. We will still continue absorption, so we'll do part 2 of absorption, and we'll look at the processes by which absorption occurs. All right, so thank you very much. Have a wonderful rest of the day. God bless us all.